So I hope my screen is visible to everyone. So thank you so much. So we are all set to begin today's session. Okay. Panic disorder. Well, just think about, had there been any situation, maybe when you were driving a car, or maybe sitting in a meeting, or maybe just simply sitting at your home, and all of a sudden you get a feeling of like shortness of breath, sweating, chills going through your body, or maybe hot flashes, nauseatic feeling, a sense of as if you're losing something. uh, all of a sudden the heart has started pounding. Has any one of you ever felt any such kind of sensations? Okay, some of the people are saying yes, many times. Well, that can be something wherein you may need a little bit of help. Okay, had panic attacks a few times. Yes, happens with me sometimes. So is there any kind of situation which creates this kind of feeling, or it's just all of a sudden? Was there any moment or anything that had happened in the life? Was because of that? Was it because of that, or it was just out of the blue? Okay, excess anxiety once, situations, all of a sudden without any reason, out of the blue. Okay, when you feel disappointed, it just happened, situation related, moment based. Okay. Okay, triggers. Maybe due to the past events, it has started with me frequently because of probably anxiety as I oh, that was really sad. And obviously such situation can trigger such kind of conditions, but it's really very sad, but I hope you'll deal with it. When you're stuck in a giant wheel, oh yeah, right. uh, that can happen when you go for a ride on those giant wheels. Okay, when I think of my aunt, she died in 2015. Okay, after vertigo attack. Okay, my one client gets panic attack when her mother-in-law comes in to stay with her. She becomes anxious. Oh my god. I don't know whether that's actually a panic attack, or I don't know, just uh, that in-law and that kind of thing, god knows. So anyways, okay, fine. So basically, yeah, mother-in-law phobia. Rightly said, Navya. So well, we can't say about that much, but yeah. So there can be situations when maybe some incidents, some traumatic incidents in life, which can trigger certain kind of emotions in you, which can lead to a feeling of anxiety, panic, a sense of hopelessness, losing. Yeah, that can happen, but it is because of a situation. And chances are there that after some time, once you get over that traumatic situation, uh, that panic situation may also be over. You may get over it. But with some people, it continues. It continues even when there is no situation like this in the life. even when there is nothing happening, and all of a sudden, they start getting those attacks. And there are these frequent uh, repetition of those kind of feelings and sensations. So definitely such kind of situation may be termed as panic disorder. And definitely there is a grave need in this situation for some kind of help. uh, Either it can be a medical help also, along with that there can be some counseling help also, along with that some personal remedies which a person can use when this kind of situation appears. So today we'll be talking about some such conditions of panic disorder, like what are the symptoms that are there, uh, some basic causes about it, and what are the remedies that we can use them at our own level. Definitely we will need some more specialized help, but some of the remedies that we at our end can use, that will be really helpful. So we'll be talking about it. Okay, so moving ahead, let's discuss about some of the physical symptoms of the panic disorder. So some we have already mentioned. Any more symptoms that you feel can be related to panic situation? Fast heart rate, palpitations, yes, very correct. Anything else? Okay, talking to myself, sweating, going blank, losing focus, heaviness in chest, numbness, breathing problem, breathlessness, between life and death light, yes, difficulty breathing, chest pain, blur vision, butterflies in stomach, eating disorder, okay, choking, sudden jerk in stomach, hand shivering, quite a lot of symptoms. That trembling, yes, difficulty in focus, dizziness, yes, these all are the various symptoms of any panic disorder. So overwhelming feelings of anxiety. See, anxiety itself is a part of panic disorder. The person feels overwhelming feeling, just gets anxious with the situation and is not able to deal with it. So that is one of the part of panic disorder. Intense fear that appears from nowhere, like uh, some of you said, out of the blue. There is nothing, nothing to be fearful of, nothing which can cause you any such sort of feeling, but just there is like a feeling as if someone has got hold of your heart. you know there's that lurching feeling in your heart, as if everything is getting lost, or fear of losing, or maybe fear of death also sometimes. So that kind of feeling is basically a symptom of panic. Heart pounding, yes, the heartbeat goes up very high. In fact, it seems as if it is one can hear it in their own ears. That way the heart starts going. Have a hard time catching your breath. Shortlessness of breath, like person is unable to breathe, as if they say like we need fresh air, and still they are not able to breathe properly. So that kind of feeling is there. Sweatiness, yes, all of a sudden the person becomes all sweaty, and not able to control that situation. Some more symptoms: trembling or shaking, like already some of you have said. Hyperventilating, yes, Um, Dizziness or lightheadedness, yes, sometimes people start losing kind of, they start feeling kind of unconscious, as if they are losing their senses. So that kind of feeling is also there. Numbness or tingling sensation, yes, any of the part of the body, they'll feel as if it has gone numb. They can't feel any sensation there, or maybe some kind of tingling sensation may also be going on in the body part, which is uncontrollable. Then a chest pain or discomfort. Now this is something which is a part of panic disorder, and sometimes people misinterpret it as having a heart attack also. Some people, during this panic attack, they feel kind of a, congestion in their chest, and they misinterpret it as having a heart attack. And in fact, this condition, in fact, even spoils that situation even more, because the person panics even more, thinking that he is having a heart attack. So that even worsens the condition. But one has to, although some of these symptoms can be a part of heart attack also, some of the things that the person may feel during a heart attack also, but every time it can't be unless and until a person is having already, if he is having a history of having the panic attacks, definitely in that condition it is important that immediately they should go to a doctor and consult, so that they're able to solve the situation, because in both the cases it can be dangerous. Either, maybe if it is actually having a heart attack situation, but person taking it as just as a panic situation and not going to the specialist, so that can also be very dangerous. So this thing is something which needs to be taken care of. Chills or hot flashes, like I said, through the body, the person may feel as if, just like some kind of hot flashes are moving through his body, as if everything, that hot uh, something is rushing through the body. So that kind of feeling is also there, or some chills going through the body. So that is also one of the feeling of the physical, are one of the, some of the symptoms of panic disorder. This kind of panic chest pain lead to actual heart attack. I don't think so, not always. That is the reason I said that if there is any such kind of thing like chest pain, definitely it is important that immediately the specialist need to be consulted. We can't take it lightly. Yeah, but sometimes the panic can lead to that kind of situation, or even vice versa also. But immediate doctor's consultation would be needed. We can't assume any such thing on our own end. Angry in panic attacks. Yeah, see, some of the symptoms are, some of the symptoms are common in all the people, but some of these symptoms can be particular to some people. The way they handle their situation, because they are not able to handle the situation, so they get frustrated, they get angry, not able to deal with that situation, that shortness of breath and all. So it may cause some kind of irritation in their mind. So that can, yes, happen. Okay, so thank you so much, Dr. Manpreet, for sharing that. Chest pain due to anxiety acid increase in the body, it is differentiated from heart attack. So thank you for sharing that. Okay, so a person may be feeling chest pain, like Dr. Manpreet said, that due to the anxiety acid which has increased in the body, but it is different from heart attack. So that is the reason I said you need a specialist to diagnose for you whether it is a heart attack or whether it's just it is a panic attack. Okay, now moving on to some of the psychological symptoms of a panic attack. A sense of unreality, derealization, or being detached from oneself. A person, kind of loses his sense of reality. He sometimes, in fact, during the panic, he is not able to connect with others also. He gets detached from himself and from others because he is so much engrossed with that fear, that intense fear which is holding him, that he's not able to connect with others, maybe not able to understand what others are saying, or even himself. He's feeling, that is something he's losing. He's just he himself is not a part of himself. He's just losing out everything. So there is a sense of unreality. Everything is going in vain, everything is lost. That kind of feeling is there in the person. A fear of dying, or that something bad is going to happen. Like I have already told, that there is a fear that maybe, it's just a death like feeling, as if I'm going to die, or something bad is going to happen without any reason. The person is having all such sort of things in his mind, and he is unable to control those thoughts. He's unable to, even someone will try to give them some kind of consolation, trying to help, tell them certain things, okay, it's okay. And at that moment of time, it is very difficult for them to understand that there is nothing like such. They will just get that feeling, and to come out of that feeling, uh, definitely certain methods, certain techniques would be needed. We have certain chats. Okay, being too paranoid, yes, that will be a situation like of a paranoid, not losing the senses, losing the ability to understand, fear of something bad happening, as if everything is maybe people feel that as if the life is getting drained out of them. So that kind of feeling is what they are getting. A feeling of smothering. People feel that suffocating, as if someone is like holding something on their mouth or their nose, and they are just trying to, so that kind of feeling, the kind of suffocating feeling that you get when someone is trying to choke you. So that kind of feeling is also there with the person. A fear of losing control or going crazy. You will hear such people saying repeatedly, I'm going crazy, I'm losing it. They don't understand what is going on, what is going to happen, how they are going to control, and everything seems out of control. So they feel as if they will lose their mind, they will lose their control. So that fear of losing control or going crazy. So these are some of the symptoms, general symptoms. Like I said, there are certain general symptoms which may be common in everyone, but then there may be certain particular symptoms which will be related to certain particular people, depending on their way of behaving and dealing with situations. So my next question is like, what do you think can be the causes for these panic attacks One we have already discussed, like any of the traumatic situation in life. What other than that can be reasons for panic? Okay, fear, hopelessness, things out of control, overthinking, failure, loss of someone, relationships, anger. So, okay, family problems, train of thoughts, uncertain events, exam fear, trauma, loss of jobs, okay, negative approach, overthinking, low confidence, change in routine. Uh, so I think these are all situation based conditions. Mental illness, withdrawal symptoms, okay. When people do not understand you, wrong environment of bringing up, okay, right. So basically, yeah, death of near ones and attachment styles in childhood, traumatic events, drug abuse. So basically there are n number of situational conditions which can lead to panic attacks. But do you think panic attacks can be genetic also? Are panic attacks genetic? Okay, some are saying yes, some are saying no, some are saying maybe. Okay. So basically, if we see panic attacks, yes, panic attacks can be many a times genetically transferred. If they are somewhere, maybe the parents had a history of panic attacks, then the chances are there that they may get transferred into the child. So sometimes it can definitely be genetically. Then the next cause for a panic attack can be major stress. Like we have already seen so many incidents which have been stated, wherein there is some kind of situation in life, so some kind of uh, situation where a person is dealing, maybe losing someone, losing job also. It can be related to any of the situation, change, or maybe sudden change in the life situations, maybe moving to some other place also sometimes can cause panic for people. um, so any of these situation can cause stress for a person, and that kind of stress can lead to panic attack. Temperament that is more sensitive to stress or prone to negative emotion, yes, this is also one of the big causes for panic attacks. People who are you know having that kind of temperament, tendency towards negative thoughts, negative kind of, they experience negativity in their life more, so they have more chances of developing panic attack, because somehow they are prone to such kind of situation. And why they are having negative emotions? Definitely because they are not able to deal with their situations in a proper way, and probably that is the reason that they have more much of negative emotions. And because of that also sometimes they can develop the panic uh, disorder, or they can start having panic attacks. So the temperament of a person, how he deals with the situation, uh, all those people who are resilient, who got the ability to bounce back, usually they won't experience such kind of a situation. But those people who are not able to deal with situations, they are not able to handle any such kind of conflicting situations in life or any kind of traumatic situations in life easily, have a tendency towards negativity, they will definitely be more prone to developing the panic situation. Certain changes in the way parts of your brain function, definitely sometimes maybe due to some kind of chemical imbalance in our brain, that can also be one of the reason for panic attacks. So the causes can be any of them, but ultimately this panic situation, uh, if it is maybe once it has happened, like some of the people stated that yes, once or sometimes they have experienced in their life, depending on situation, then it's okay. But if a person is experiencing it continuously or frequently, then in that case, definitely a proper guidance, support, and help is needed. Are these brain changes reversible? Well, in that case, they will need help from certain medical medications and all. So definitely that is not under our area of discussion, because that is the area of the doctors, the ones who deal with this thing. So they will be the ones who will be able to give them medications. So we will be discussing about those remedies which we can take at our own end, right? But yes, there are definitely certain medications which can be used and prescribed by the doctor. Okay, now already if a person is having a certain proneness towards panic, there are certain conditions which can be the risk factor, which can increase the risk of uh, having panic attacks. The symptoms that we have already discussed, and things like that. So sometimes there are certain situations, such certain conditions which can be a big risk factor for such people, because it can trigger panic situation in them. Like for example, it is researchers show that women develop more panic conditions as compared to men. So that can be a risk situation if one is a woman, and already if they have a maybe genetically they are prone, or maybe due to any of the other reasons, so they are more at risk in this situation. So so what can be the risk factors? Obviously, like we have discussed already, genetics. So family history, if there has been a family history of panic attacks or panic disorder, so then definitely the person will be more at risk of developing that disorder. So in case if they see such kind of symptoms, so they have to be more observant, they have to be more careful. If they are developing any such kind of symptoms, they need to pay attention on them rather than just ignoring them. They have to pay more attention to them. Why? Because they already know that they have a family history, and they can be at risk. So this is applicable with any kind of diseases that we have, like for example heart related diseases and all. If there is a family history of heart diseases, then definitely the person who's there will have be having more risk in that condition. So same way is with the panic. person needs to be more observant about this condition. Like already mentioned by many of you, that major life stress such as death or serious illness of a loved one can trigger panic. So this is one of the major, maybe it because it's a traumatic situation for the person, and obviously the person is not able to handle that situation. So because of that, it can also become a risk factor for the person, which can cause panic for them. A traumatic event that may have happened in the life of a person, like a sexual assault or a serious accident, can also be a reason for panic. If a person has faced any kind of accident, some major accident in which they have survived, so if they will face any such kind of situation, even the smallest of that situation, or sometimes even maybe when they see it also, maybe in a movie or a television, so that can also trigger that emotion in them and can cause panic attacks. So this kind of any such situation which they experience in their life can trigger the panic attack. Okay, so in fact I think accident wise, so many, like any one of you who may have experienced any such thing in life, it's not that we ourselves, if we sometimes just we have seen any such accident happening in front of us, or any such major incident which is happening in front of us, so definitely that has triggered those emotions in people. Other than that, other major changes that can take place in our life, just a second. Sorry, I'll just share the screen once again. Yeah. So so any kind of major change in the life of a person that a person may have experienced, maybe divorce, even sometimes domestic violence also can be there, or any such issue, any such thing which they may have, even sometimes women are when all of a sudden there is a change in life due to a newborn baby, so they are not able to handle that situation also, and that can also even sometimes trigger panic attacks in them. Maybe sometimes there is a condition where they were not so much sure about the baby, and when the baby comes in their life, and the person feels that maybe he's not ready to handle that situation, so in that condition also the person will experience panic attacks. Okay, people who are already having genetically, who are having this history of panic and all, so in that case smoking or excessive use of caffeine intake can also cause panic attacks, and it can enhance the risk factor in such people. And they can because they are already vulnerable to that situation because of that genetic endowment that they have got. And in that case, if they are following this kind of unhealthy lifestyle, smoking or drinking or any such sort of thing, so that can also trigger that panic situation in them. Sorry, just go back. Yeah. Now, definitely, when person already who's having who's already maybe having the risk factors which can cause panic attack in them, and then and if the person develops any such conditions of panic, there are certain conditions which can complicate the situation. And the most simplest one can be if the panic attack, like the panic situations, if it is left untreated, if people just take it for granted that okay, I just had this kind of feeling, it's okay, it's done now I don't need any kind of help. So if it is left untreated once, like I said, it's okay. But if the person is continuously facing that situation, and if he is not taking any help, any support, any treatment, then definitely those things can not only they are a problem, the panic attack is a problem, but it can affect the various areas of his life also. We have got so many chats. Let me check it first. Okay. Yes, postpartum depression. Yes, that is the term. Like I said, that sometimes people who suffer from postpartum depression can also develop panic attacks. Oh, okay. So Vandana Yadav is sharing her experience that I was mugged and hit on head and woke up on the street. I was missing for 8 hours in Tennessee. Most scary event, still get shakes. Yes, definitely this kind of incident in anyone's life, it can lead to panic. Whenever a person will face any such kind of similar situation, even though it may not be that physically it may not be so much dangerous, but still, because you have those emotions, those experiences, those thoughts in your mind, it can definitely trigger. So yeah, definitely this is something which anyone can experience in their life. Okay, so talking about the complications, like I said, uh, if a person is constantly experiencing this kind of symptoms, and if he's and if it is not taken care of, then definitely it can lead to many complications in life. Like for example, development of a specific phobia such as fear of driving or leaving your home, like the condition which Vandana shared. If a person is not able to handle this situation, and if he's not taking some kind of help, professional help, that can lead to development of phobias. Person may develop phobias related to such situation, and it can be even more problematic. So taking a professional help in this situation is very important. Next, frequent medical care for health concerns and other medical conditions. If a person is having certain medical conditions, certain things, maybe like we have already discussed, if he has developed some kind of chronic disease or something, so that can also lead to development of panic attacks. Avoidance of social situation. Yes, see, these are the complications related to panics. Now, because once a person has developed, this feeling of panic, so he thinks that, maybe if a person has faced this in a social situation once, in a market, or maybe during a meeting, now the person is even more fearful that if this happens again in a social situation, how will I deal with it, what will people think about me? And so because of this, they start avoiding these social situations also. So that can be even more, uh, uh, you can say, it can be more detrimental for them. Reason being, because of this, they are now isolating themselves from people, and it can even lead to more worsening of the condition. So that is why it is very important to not to leave this panic attack and taking it just like normally, that okay, it has just happened because of a situation. If a professional help will definitely be needed to save yourself from all these kind of complications. So people will face a problem at their work or school, or even in their family life also. They will be not be able to face those situations. They will start avoiding things, working and all. So that is, these are the complications which are created because of the panic that the person is dealing with. So it is even worsening the life. It can further be enhanced because it can lead to depression, anxiety, and even some other psychiatric disorders also. So like I'm saying, if one is not able to manage, if it is, it is a frequent, if it has happened once or maybe twice, then it's okay, it was situational. But if it is continuously occurring, then definitely it's a disorder which needs a professional help. Okay, previous slide. Yeah, just a second. Yes. So these are the complications which may appear if we leave the panic untreated. So should I move on? Okay, so like I said, depression, anxiety, and other psychiatric disorders. Then obviously, if it is leading to depression and such sort of things, and it is prolonged, untreated, it will increase the risk of suicide or suicidal thoughts, because the person is unable to deal with that condition, and it is destroying his life. He is unable to, that dying kind of thought which is again and again coming to his mind. So that will provoke the person, and it can, it is a big risk which can lead to suicidal thoughts, or even sometimes suicide also. So in that case, it becomes very, very important that a proper help, maybe medication also, maybe other kind of therapeutic support will be needed by the person. Sometimes people, because of this situation, they switch over to alcohol or substance misuse. So because they are unable to deal with that situation, so they start using these substances and all. So that can also be a complication which can be caused by panic. And definitely the financial problems. If the person is, due to his panic situation, he is not going for work, he's not going out, or if he is entering into alcohol or substance misuse, all of these conditions will definitely cause a financial problem. So these are the complications which are related to a panic disorder. It's not simply a disorder, okay, which can just be taken like that. It will need a proper help. Okay, so we have certain, yeah, definitely swing sharp objects, impulse to kill himself or herself. So that kind of a person will get that kind of feeling. So that is the, he has moved towards the suicidal thoughts. If the person has moved towards the suicidal thoughts, then definitely some or the other way he'll get that impulse of killing himself, they may be hurting themselves also. Okay, so that can be there. So these are the complications which are related to the panic disorder, and they need to be dealt with properly. So now, what do you think can be the preventive measures for a panic disorder? What can be the preventive measures for this? Yes. Talking it out, breathing exercises. Yes, correct. Avoid triggers, meditation, diet, meditation, hobbies, positive thinking, breathing exercise, counseling, vent out to someone they can, mindfulness, communication, okay, various techniques, speaking up about the situation, relaxation exercise, spiritual, delete technique, yes, joining a support group, positive social group, proper daily routine, boundaries, writing, yes, 352 breathing exercise, correct, reading, hobbies, knowing the right cause, engage in something, staying calmer, doing something which brings joy, listen to music, yes, seek proper consultation, journaling, sorry, meditation, yes. So basically these are all the preventive measures. These are preventive measures which person can take at on his own level, to prevent further coming of panic attacks. But at the same time, like I have already told, if the person is continuously experiencing it in his life, then definitely they will need a proper professional help, maybe from a doctor or a proper expert in that field. So talking about the remedies, like most of them have already been mentioned by you all, like exercise is one of them, because it is considered that a physical, any kind of physical activity, when you do it, releases certain happy hormones in your body, so which are helpful in controlling some of those symptoms which appear as a part of panic attack. So exercising is, yes, definitely one of the most important remedy, which can be, it can be in any form, maybe some people like dancing or anything, so they can do whatever way, but it will definitely help. Then practicing breathing and relaxation techniques, yes, there are several relaxation techniques. There is so much of relaxation music and all that you have. One can practice various types of relaxation and breathing techniques that we have. So they can be really very helpful. Like it's already been said, 352. These are some of the breathing techniques. Relaxation, muscle relaxation, step by step muscle relaxation, and all these things will definitely they will bring down the level of panic that a person has. Then focusing on self-care. Self-care is very very important. Person needs to think about all those things which makes him happy, like again getting into exercise, or maybe doing some hobby, like already said, some kind of hobby, get into some kind of interesting, learning something interesting. So that will see, because what happens, panic is basically when your thoughts, when you are unable to control your thoughts and all. So once you are engaged into something, definitely chances are there that you'll not switch towards those thoughts which are a trigger for your panic attack. Next is be kind to yourself. Uh, Many a times when this kind of situation happens with people, so people become like they kind of sometimes they become self-criticizing also. They like, I'm like this, my life is like this. Sometimes maybe due to some situation they'll say I deserve this, maybe something which has happened in their life, so they will say I deserve this. It is very very important that the person needs to be kind to himself rather than saying all those negative things. He needs to be more affirming, needs to say things like it's okay, yes, this situation is there, I know I'm facing this situation, but I will deal with it. So they need to be, I may take some time but I'll deal with it. So they need to be more kinder with themselves. That is very very important. We've got several comments. Okay, okay. You were on medication. Self-blaming, yes, self-blaming. Medication, okay. So like I said, medication is something which is a field of the specialized doctors only, so that is something which they can deal with it. And still have panic attacks, then yes, definitely medication is something which is needed. Who do not want to participate in any activity become very rigid. I can't see your name. The name is like Zoom user, and it's supposed to be by name. Art therapy, yes, art therapy is one of the ways, but people can get into dancing, painting, all such sort of things they can do. Talk to psychologists, yes. Gardening, yes, gardening is also one of the ways to deal with it. Being with the plants and all, it gives you that positive energy. So that can also be there. Recognize that you have a panic attack. Now it is very important that, like I said, rather than just getting into maybe I'm dying or something like that, person needs to accept that, okay, I am having a panic attack. I know that this condition is bad right now for me, but I'm not going to die. It's just a panic attack. So sometimes what happens, because of that feeling of maybe dying and something like that, the condition becomes even worse. So recognizing that it is a panic attack, yeah, definitely it's easier said than done. But if the person gradually he practices this every time, if whenever he experiences this panic attack, he practices this by telling himself again, it's okay, I am having panic attack, but I'll deal with it. So when he recognizes that it's just a panic attack and not a dying situation, definitely it will help him to calm down, and that will lower down the impact of the panic that he is having. Find a focus object. Now, for example, if a person is going through that panic situation, at that moment of time, what one can do is that try focusing on something. Maybe something, start counting, maybe just start focusing on the ticking of the clock, or just focus on certain, maybe if you're outside, you can start counting maybe stars or something. So what will happen, your mind will be diverted from your those symptoms of the panic that you are having to something else. So finding a focus object can also help in lowering down the effect of panic. Use muscle relaxation technique. Yes, this is also one of the technique. Again, it's a way of focusing. So instead of focusing on what is happening in the body, if person starts focusing on the muscles, okay, start relaxing the muscles from your, starting from your foot. Okay, now I'm relaxing the muscles of my foot. Now slowly I'm moving up to my legs. My legs are relaxing. Now my thighs are relaxing. So like that, gradually when you're moving up, and when you are focusing my shoulders, I'm relaxing. So instead of again focusing on all those symptoms, you focus on something else. So even your muscles, which has become so tensed because of the panic, they will also be relieved, and at the same time it will help in slowing down the symptoms. Next is keep lavender on hand. It is said that lavender, the smell of lavender, is very good for slowing down any such anxiety or panic attacks. So you may get some kind of perfumes related to lavender or something, and keep handy with you if you are facing such kind of situation. So it helps to calm down your mind and thoughts. Okay, we have some more. Okay, Shavasana. Yes, Shavasana can be done, but again, you need to relax your mind. In that case, also, you need to first relax your muscles. With panic disorders leading to suicidal activities, see, again, we need to understand that if it is to such an extreme extent, then definitely that person will need a psychiatric help. So suicidal activities are something that can't be dealt by us. We need to recommend them to a psychiatrist, and they need a psychiatric help. Okay, so yes, walking and running, yes, definitely it can help. Chanting, yes, chanting a mantra, any mantra if you may have, or simply om, or any sort of even this humming sound, that if you continuously just sit and do that humming sound, make a bee, that can also be helpful in relaxing, in slowing down your heart rate and all those symptoms which are leading to panic attack. Yeah, there are definitely different forms of meditation. There are n number of meditation forms, so whichever is feasible for you, you can use it. Yeah, so repeating a mantra, and then finally using grounding techniques. What do we mean by grounding? What do we mean by grounding? Getting yourself back to the reality. Yes. So basically, it is a practice that helps people with the this kind of attack, or this kind of anxiety, maybe even anxiety or such type of situation, to come back out of those negative emotions. So many of these things are already a part of grounding technique. So this technique is very, very helpful, and coming out of those negative thoughts, emotions which are actually causing that panic can be done through the grounding techniques. For example, there can be various ways of grounding, like for example, mental grounding. So mental grounding is like, either you can start, like I have already told you, you start describing the various details in your environment, start focusing on the various, pointing out things. So you switch your focus to whatever is there. Let's say, for example, if you are in a room, so you can start focusing on what all are the objects there around in your room, or maybe you start counting them. So that can be a way to relax yourself. Name Then you can start naming the things in different categories. Now that is also one of the way, like you can talk about, okay, animals, so you will start naming all the animals in the animal category, then naming all the flowers. Why this technique? Because it is actually helping you to divert your mind from all those symptoms which are troubling you. So that way also it can be done. Just so whenever, if a person is in a panic situation, immediately ask them to just look around them, name the things that they can see, name the name 5 things that you can see, name 4 things that you can touch, name 3 things that you can smell, name 2 things that you can so that way you can tell them to do things. So these are the various grounding techniques which can be used, or just ask them to imagine maybe about some funny situation or something, some pleasant moment of their life which they have experienced with their family or something like that. So that can also be there. Or even backward counting, ask them for backward counting. So definitely backward counting needs more mental effort, so that will also be very helpful for them. So these are mental grounding techniques. Then other than that, certain physical grounding techniques can be used, like for example, running cold water or warm water over the hands and face, washing the face and hands with a cold or warm water can also be of some help. Okay. Just imagine that when that water is running through your hands and all, so it is like kind of taking away all the sort of problems that are there in your body. So that kind of thought can be very, very helpful. uh, Touching different objects around you, that can also be very helpful, trying to feel, when you start focusing on feeling different objects around you, so that can be very helpful. um, uh, then saying kind things to ourselves, like I have already said, say be kind to yourself, say kind things to yourself. It's okay, I know this is the situation, but I'll be able to deal with it. Then you can think about something favorite of your, you have maybe your favorite chocolate or ice cream, or your pet or your friend, anyone. So that can also be, it will soothe down your nerves. So that way also it is very helpful. uh, Remember some inspiring quote and read it out, say it loudly to yourself, keep repeating it to yourself loudly. So that can also be very, very helpful for you. So these are certain grounding techniques which can be helpful at that moment of time. It may not completely elevate the problem, but it may soothe down the person a bit during that panic situation. So such type of grounding techniques can also be used. So that's it from my side, there are some more chats. Okay, let me just stop sharing. Okay, yeah. Close your eyes and focus on breathing. Yes. Mindful meditation. Yes, correct. Chamomile tea. Yes, you know, these are certain things which can definitely help you out in soothing. Accept the way as you are. Things you can touch, smell, hear. Yeah, definitely, these are the ways. 5 things you can see, 4 things you can hear, 3 things you can touch. So that is a way to help out in soothing. Yeah, definitely, like I said, it's not going to completely eradicate that panic. For that, you will need a proper uh, uh, um, help from a professional, help from someone. But these are the techniques which are like remedies whenever a person is facing a panic situation. So at that moment, or if we are there and if we see a person facing a panic situation, so these are certain remedies which can be given to that person at that moment of time to, you know, just slow down that process of panic which is going on. But definitely, if it is a prolonged problem, it needs, like again and again and again I'm saying, it needs a professional help. And if it is left untreated, it will cause various other complications. So that's it from my side. And we are already over the time is 7:09. So that's it from my side. And thank you all for being so participating. Uh, thank you, everyone.